Well, May is Mental Health Awareness Month, and all week we'll be highlighting conversations and resources surrounding mental health and wellness. This morning, we focus on youth mental health.
Yeah, 1 in 5 teens are reporting feeling lonely. That's according to data from Common Sense Media. Experts say this can have a significant impact on their self-esteem, their academics, their physical and mental health. Dr. Gregory Leskin is a licensed clinical psychologist with UCLA Health, and he's here to talk about this rise in loneliness among teens and how adults can address the issue. Thank you for being with us this morning.
Good morning, Sheila. Good morning, Rachel.
Good morning.
Hi, good morning. So yeah, these numbers are very disturbing, especially because I think you think of the teenage years as some of the most social in your life. So why are teens struggling so much?
Oh, that is a very good question. Good morning. I'm so glad that we're talking about child loneliness this morning, and really child mental health. And this trend towards loneliness has actually been taking place for quite some time. And the research would suggest that 1 in 5 kids experiences some type of loneliness in their life. And that's a growing trend. We've been seeing that well before the pandemic. And there's a lot of reasons for that. You know, parents are stretched. You know, we're relying a lot on social media. There's other reasons, including, you know, we've lost the ability to go outside and have unstructured play. So all of these factors are playing into that sense of loneliness. And I do want to pause and just define that term loneliness for a moment, because loneliness is not just being alone. It is a painful feeling of being separate and apart. It's feeling unseen or unheard or like one doesn't matter. And so we really need to think about what are the factors that may be contributing to that child feeling those feelings and not feeling seen or heard or mattering.
Well, you know, doctor, if loneliness is one of the, biggest drivers of the youth mental health crisis, 2 questions for you. First, why is it not talked about more? And secondly, what can adults do? You know, what signs should they be looking out for?
You're absolutely right, Rachel. This is not a subject that we often talk about, loneliness. And it is really important that parents or trusted adults really take the time to tune into the child's emotional needs. That's really key. So finding ways to check in, to ask questions is really key to understanding the child's emotional life and their sense of belonging, their sense of mattering. All of those are really key and critical elements.
When you talked about those factors, a lot of them are societal factors. So can we make a difference individually if as a society we live more digitally, our lives are online, we're not as connected with our neighbors and our families? Can we do enough as individuals to compensate for what it seems society is contributing to this problem?
Absolutely. We all know that community is really essential. So being able to not only have like an individual, like trusted adult in the child's life who really is available, attuned to the child's needs, who's asking questions, not just asking questions like, how was your day, but really trying to help the child make sense of the world that they're living in, the information that they're receiving from social media, the information that they're receiving from AI. All of those are very essential elements for what the parent or trusted adult can do to support that child.
And doctor, like Sheba mentioned, we live in a digital age. We can't deny that. But developing friendships is a skill, right? It takes a certain amount of skills to do this. How can we teach our teens to make friends?
Rachel, that's such a good question. Making friends is a skill. It's not just luck. So we help parents to help their kids, first of all, model developing friendships through asking questions of others, being interested in other people rather than just being interesting. So really checking in. It's the helping kids to find the child who may not have any friends and be able to check in with them and show kindness to others. So all of those elements of learning how to make friends with others is really essential. It's very important.
Well, very important conversation. A lot of parents worried about this and want to help their teens. So Dr. Leskin, thank you so much for being with us this morning.
Thank you so much, Rachel.
We have mental health resources at cbsla.com/mental health, and you can also find information about tomorrow's NAMI Walks Mental Health Festival. CBS LA Cares is teaming up with the National Alliance on Mental Illness to bring you a day filled with fun, community, and a lot of resources. All right, should be a great day tomorrow.